First of all, let me thank all the subscribers for their enthusiastic response to my videos. Hope to carry on the same in future as well. Painful sexual intercourse. Now, it's quite normal and natural for the female to have pain the first time she has sex. But if it persists, then there is something wrong. The most frequent cause of painful sexual intercourse is reduced lubrication in the vagina. And this happens in two primary situations. One is when the woman is distracted, not interested in sexual intercourse, as when the kids are growing up, there's a whole household to be seen, kids have to be sent to school, husband has to be catered to, and all these things take over the pleasure of sex. There's decreased lubrication and hence painful sex. The other indication where painful sexual intercourse happens can be understood by the fact that females take longer to get aroused as compared to men. Now, men unfortunately do not recognize this point, and as soon as they are aroused, they think it's all okay to start the physical activity without noticing that the female is not fully aroused and therefore not fully lubricated in the vagina. What are the symptoms of fully aroused woman? The nipples become hard, the breast becomes engorged, there may be a facial flush, labia majora, the outer lip of the vagina, becomes swollen, and there is a wet vagina. So when all these things are present, then it's all the right time to have sex. If this is ignored, as it is in many cases, in most of the cases, men do not pay much attention to foreplay. And in my opinion, foreplay is as important as the sexual intercourse, physical part of that. Therefore, an adequate foreplay is the need of the hour to prevent painful sex, especially in younger women. The second most common cause of painful sex is presence of infection of the vulva and vagina and the cervix. This is quite common in women when they have fungal infection. There is a curdy white or curdy yellowish discharge from the vagina, and then because of the inflammation, the sex is painful. It also happens in urinary tract infections, particularly when it affects the urinary bladder, because the bladder being inflamed, front part of the vagina gets very sensitive. These situations can be controlled quite easily. Lubrication problems can be controlled by men paying more attention to foreplay rather than just simply giving it no time and starting out before the woman is aroused. The second very simple thing to do is to get the lubricant from the chemist, freely available. Water-soluble lubricant is the one that is required, and that can sort out this problem. The problem about infection can be sorted out by getting it treated with appropriate antibiotics or antifungal agents. You will have to see your doctor for that, the gynecologist. The third most common cause of painful sexual intercourse is what is known as vaginismus. This is a psychosomatic disease. Psycho means brain and somatic means physical body. So it's a combination of both the physical defect and psychological assessment of the situation. What happens in this situation is that as soon as the penis is brought close to the introitus or the opening of the vagina, there is a spasm that's set up in the muscles and they're squeezed tight, preventing the entry of penis. What to talk of penis? Even a finger can cause this problem in women who have this vaginismus problem. And introduction of even a finger can cause immense pain to the woman, because the vaginal muscles become so tight that they refuse to relax and send pain sensation to the woman. This may have a basis of child abuse in cases where the family rules and regulations are very strict, and also in cases where there has been a rape in the past or mutilation of the area involved. Clearly, this requires psychological assessment and psychological management as well as a management of the local area. But it's a complicated problem and it needs expert counseling as well as expert gynecological interference. And therefore, the best person to see is your gynecologist who has dealt with such cases in the past. Vaginismus. The other reasons why a lady can have painful sexual intercourse are on deep penetration, when there's a presence of many fibroids in the uterus, or when there's infection of the tubes and ovaries, when there's pelvic inflammatory disease, as I mentioned earlier, when there is cystitis or infection in the urinary bladder, when the cervix is inflamed, or in a situation known as endometriosis, where the mucosa of the uterus, the cells that line the inner lining of the uterus, go outside the uterus and spread in the local area. Then also they can have painful sexual intercourse. Finally, in carcinoma of the cervix, cancer of the cervix, sometimes comes to light because there's painful on deep penetration. When the penis touches the cervix, there may be bleeding and pain. And some cases can be diagnosed on that basis. So ladies and gentlemen, those are the frequent causes of painful sexual intercourse. And now you know what to do in situations like that. If you've liked my video, press the like button. If you have any comments to make, if you have any suggestions, please do make comments in the comment section. And do not forget to subscribe to the channel for more information on sexual health. Till then, goodbye.